My name is Dr. Barbara Kieber. I'm a family physician and I work at Glen Cove Hospital, Northwell Health in Glen Cove, Long Island, with the Family Medicine Residency team. This presentation, entitled Creating an Interprofessional Team to Care for a Vulnerable Population of Patients with Diabetes, was designed to describe the way a team of various professionals can come together to improve the quality of care for patients living with diabetes in a family medicine residency program. We work with an underserved population who often have limited finances, limited literacy and numeracy, and are either uninsured or underinsured. A major goal of this interprofessional program is for learners at both the residency and medical student levels to be able to immerse themselves in the process of learning to care for patients with diabetes. Typically, there is not a great deal of focus on the complexities of diabetes in medical school or in residency. Our team consists of attending physicians in family medicine, including the physician lead for diabetes care, resident physicians, and medical students rotating through family medicine. We have a nurse practitioner, certified diabetes care and education specialist, who is the lead for the ambulatory diabetes program, as well as a licensed master of social work who is also certified in diabetes care. There are also dietitians, clinical pharmacists, and clinical nurses, many of whom are diabetes champions who have had additional training in diabetes education. We have clerical staff as well as a coordinator working to ensure follow-up. The most recent addition to the team has been ophthalmology for remote retinal readings. And now I will pass it off to Dr. Lisa Shapiro.
My name is Dr. Lisa Shapiro, and I am a faculty member at the Glen Cove Family Medicine Residency Program. As with any team, communication is key for program success. We have developed systems to enhance communication amongst the team members. The first and most important is our monthly task force meeting, which includes the various team members. This enables the team to adjust the workflows and to focus on concerns while including the viewpoints from several perspectives. Over the last several years, we have continued to adjust and add to the program. One of the most significant ways of communicating the needs of patients includes the daily huddles or briefs prior to every session in the Family Medicine Center. This allows for the resident seeing the patients to be aware of the needs for each patient. Nursing evaluates patients for the social determinants of health, which allow the team to understand the social needs and provide support for our patients. Communication has been further enhanced with the judicious use of the tasking system within the electronic health record. This allows for refill requests, questions to be answered, referrals to be made, and for general communication. We also use Microsoft Teams and walkie-talkies for more immediate questions and communications. Now I will hand it off to Mary Muscarello.
I'm Mary Muscarello, nurse practitioner, certified diabetes care and education specialist. In 2018, we acquired 2 point-of-care A1C analyzers in the Family Medicine Center. A1Cs are resulted in real time, so patients are informed of the results, medications adjusted, education provided, and referrals are given during the time of the visit. This has reduced the number of visits that patients need to attend and take time off from work, as well as greatly decreasing clinical inertia. Push-ins to resident appointments by the nurse practitioner and social worker diabetes educators have allowed for additional education, including teaching about the disease process, insulin administration, and meter use. Labs are now obtained right in the clinic rather than sending patients to the lab. We have added 2 specialty clinics per month for diabetes, which consists of 4 one-hour appointments in each session. In these sessions, we see patients with uncontrolled diabetes with complex needs. The resident is able to spend a full hour with each patient together with the diabetes NP. This enhances both the patient and resident experience. Additional patient education is available on-site with both diabetes educators to increase safety and confidence with injectable medications and glucose testing until patients can manage on their own. They are also available for questions by phone, and social work assists with prior authorizations for medications and supplies needed for those who have insurance. Pharmacy discount cards are also given for lower-cost medications. Medications are provided for a small number of patients who have no means to purchase and would otherwise have repeated visits to the ER and recurrent admissions. This has reduced those visits and the need for readmissions for these patients. We recently obtained the RetinaView camera to screen for retinopathy. Pictures are sent electronically to an ophthalmologist for review. The pictures and diagnostic report are transmitted directly into the EHR, and the resident contacts each patient with results. For those with abnormal exams requiring ophthalmology follow-up, transportation is provided via a grant. I'm now going to hand it back to Dr. Shapiro.
We have developed the team and our processes over the last 3 to 4 years, and this has also included significant adjustments made during the COVID pandemic. During the initial surge, many patients were unable to obtain medications or come to the center for follow-up or refills as needed. Our social worker performed amazing outreach to ensure refills of medications were maintained, as well as assuring that patients with diabetes and at high risk were set up for vaccinations at the earliest opportunity. Our nurse manager also assisted with that process. We had a very high acceptance rate of vaccination within this vaccine-hesitant community. Many patients have received booster doses as well, since we have been able to provide those on site. Now I will hand it over to Dr. Alex Cortez.
Hi, my name is Jose Alejandro Cortez, and I'm one of the second-year residents at Glen Cove Family Medicine Residency. The education for residents around diabetes has also been enhanced with several different methods. The sessions with the diabetes MP have improved the residents' ability to manage more complex patients with diabetes, and has been a favorite session for residents. Our MP, along with the social worker, have provided educational sessions, originally quarterly and more recently monthly. These sessions have included hands-on sessions regarding meters, continuous glucose monitors, and insulin use, as well as education on the newer diabetes medications. Case presentations have been added to examine the management of complex patients with uncontrolled diabetes. These case studies are presented by the residents and then discussed with the group led by our MP. This too has been very well received by residents. And now I will hand this off to Dr. Kieber.
So our data has shown the improved quality metrics that we have been able to attain with this comprehensive team-based approach. Our residents feel better prepared to manage diabetes at graduation and are comfortable with more complex cases due to the education provided in our program. Thank you for viewing our presentation.